Hi, I am Kelly Whitman, Vice President of Substance Use Disorder Services and Housing with Best Self Behavioral Health. I want to tell you a little bit about how our mobile substance use disorder services program began.
Recovery Connections, and this brand new mobile treatment program is for people struggling with opioid abuse and addiction. These numbers just in today showing 200 confirmed opioid deaths in 2017 and 119 suspected deaths for 2017. So far this year, there are 12 suspected opioid deaths, and this is why Erie County has come up with some drastic new ways to battle this epidemic. And tonight, 7 Eyewitness News reporter Ed Riley takes us along for the ride.
Crack cocaine was my choice, but I did opiates, I did alcohol, marijuana. If you had something and you said it would get me high or take me to another state, I tried it.
When it comes to addiction, Mona Lisa McKeechin knows what it's like because she lived it for 20 years.
Of course, I wanted to break the habit, but I couldn't. I was just caught up in the grips. I was caught up in a vicious cycle.
Her cravings for drugs caused her to lose her kids, and she ended up in jail.
I mean, the shame, the guilt, the always feeling like a failure. A lot of people call it low self-esteem. I call it no self-esteem.
But a combination of having a grandson who needed care and turning to religion finally gave Mona Lisa the incentive to get into recovery.
I'm always telling straight up, I'm just like you. We're equal.
She has been drug-free for several years, and now the Buffalo woman is part of a new mobile opioid treatment unit that is being deployed by Best Self Behavioral Health.
There's certainly a lot of office-based treatment centers in Erie and Niagara County, but obviously there's people who have a hard time getting to those places. So this is really the opportunity to bring treatment to the people.
The Recovery Connection program uses 2 RVs, which have been converted into fully functioning clinics.
We're going to install a telemedicine capacity so that we can have a prescriber back at the office who can interview a potential patient.
Using teams comprised of nurses, counselors, and peer advocates, the mobile units will travel throughout Erie and Niagara counties.
This is going to be a huge game changer.
We have to do something. We are in a crisis situation.
Today, Lieutenant Governor Kathy Hochul and Erie County Health Commissioner Dr. Gail Burstein cut the ribbon on the new program.
The target population for this mobile program was for, of course, individuals who have an opioid use diagnosis. However, we don't turn people away if they have an addiction to other substances. We will still serve them. But also there needs to be some type of barrier to them being able to participate in a traditional clinic. So whether that there's not a clinic close to them, maybe these are individuals who feel like they're not in need of services. So our role in that situation would be to engage have the peer and the counselors. We work with the individual to continue just building a rapport and engaging them and hopefully getting them to a place where they can see how treatment could benefit them, and then we could link them to a clinic. Some people may have barriers such as they have no insurance to seek treatment. So then we're going to provide them treatment while we work on getting them benefits. We have some individuals who have physical health concerns that really limit their ability to get around to go to a clinic, but they have a significant opioid use disorder and they need treatment, but they can't physically get to the clinic. And some have mental health. Maybe I know a couple individuals that we encountered, they had some significant anxiety and fears with going into the clinic. So again, our target population are those individuals who are not able to go to a traditional clinic. Our goal is to stabilize them, work with them, and ideally within several weeks, maybe about a month's time, we want to have them at a point where they're ready to transfer to a traditional clinic. Of course, that's not going to be the case for every individual we work with. Some individuals we have worked with for several months before we were able to transfer them. But for the majority, we're able to get them transferred within 30 to 60 days. We link them to treatment providers in the community, not just Best Self clinics. So whatever clinic that's in their area or of their choosing, but we work to link them with that agency. We get referrals from a variety of entities. We are well linked with the drug courts here. We have a number of treatment courts. So opioid court, drug court, and we have family treatment court. We receive referrals from all of those courts. We actually have members of the mobile team that go to court for several hours a day. A lot of times, what will happen in the court system is the judge may have someone who was arrested the night before. And when the judge calls them to appear before them, they may give them the option of linking with the mobile team. And so if they choose to do that as opposed to going to lockup, we have a staff member on site that's able to meet with them, do a brief assessment, and then we look to immediately link them to be assessed by one of our prescribers, either that day or the following day. We also, besides the court systems, we spend time at the local shelters and the soup kitchens. We have days where the vehicles are set up there. And in addition to the vehicles, we have two vehicles, two RV vehicles that are equipped with the telehealth and the exam room and the restrooms. One is to serve Erie County and one is for Niagara. But in addition to those two vehicles, we have 4 regular vehicles. I think they're RAV4s. But because we also go into people's home, not everyone is going to receive treatment on the vehicle. So if we have a situation where we need to provide ongoing services to an individual in their home or someplace in the community, the RV may not be necessary. We will have a team go out in a regular vehicle because it's more comfortable a lot of times for the individuals to not have that large RV there. Even though the RV is not marked, it's still just a regular vehicle that we can go out in. We do a significant amount of street outreach, particularly, and that's one piece too that we definitely had to pay attention to. Erie County and Niagara County are very different. And so the populations are going to look very different in those two counties. So it was very important that we had people from the team that are comfortable with doing street outreach, because in the inner city of Buffalo and downtown, you have to be able to do that street outreach and engage people on that level. That's not so much the case when you go out into the more suburban or rural areas. It's less about the street outreach and more about knowing where you're going to identify the target population. So we have relationships established with the hospitals. A lot of times these individuals may rotate through the hospital, often due to relapse, detoxing, and so the hospitals got really good with calling us, and calling in the peer to engage the person while they're in the hospital. And we try to connect with them before they leave. And so being able to find different avenues to reach the population, because it varies depending on the region and the area that we're serving. So a major component of our mobile services is that we have people screened and started on medication-assisted treatment within 24 to 48 hours, as long as they're screened to be appropriate for the medication. We don't want to delay that because we understand the importance of having someone start their medication right away. And that, along with the therapeutic treatment, is really going to give the best outcome. So one of the, I think, questions that I get a lot is, typically with substance use treatment, there's a lot of groups that the individual must go to. Well, with the mobile services, we're not able to do group treatments. So in place of groups, these individuals receive intensive individual treatment. So most of them are meeting with a member of the team daily. So maybe one day they're going to have a counseling session with the clinician. The next day they might have a session with the peer. They're going to have a session with the nurse on health and wellness. They're also going to have a session with the prescriber. So we're doing intensive individual treatment. So they are indeed getting therapy, not just the medication component. And then once they're, like I mentioned, once they're able to transfer to clinic, they'll then transition into those traditional groups. Typically, when we're looking to transfer them to a clinic, we like our peer to do a warm handoff. So what that may look like is the peer actually accompanies them to their first appointment. They will sit in the waiting room with them, and if they would like them to go in, and if that's okay, and that's what the client wants, then we're able to do that as well. But we want to make a smooth, warm transition to the next provider, and we leave the case open for 30 days just to ensure the person is actually linked. So what we do early on when we engage an individual is we start providing the counseling. We see if they're, in most cases, they're going to be in need of some type of medication to also assist with recovery. And then we take them to the recovery center that's here to introduce them to what recovery supports are going to be available to them to help sustain their recovery. So we're from the very beginning looking at trying to introduce supports that can continue supporting them. So the peer may look to set up an initial meeting at the recovery center or recovery community, we also refer to it as. And at that, it's a physical building location, but we also have activities that take place outside of the building location. However, at the facility, there are a variety of activities that we try to get the individuals at least familiar with so that they know it's available. It's a very family-friendly environment. There's cooking classes and there's yoga, and there are lots of live music events and painting and lots of activities that take place at the center. There's movie night, and then people just come and hang out because it's a safe place to come. And there's other people who identify as being in recovery. So we like to introduce everyone that accesses the mobile program to the recovery community so that they're aware that this is a support once we pull out and you continue with your treatment, you can also still continue to access the recovery community. I mean, there are people there who have been in recovery for several weeks to several years. So it's a great support to have for individuals. So a common statistic that resonates with me is that 9 out of 13 individuals who are in need of substance use treatment will not access it for a variety of reasons. And so the purpose of this program is to really target those 9 who are not seeking or receiving treatment. And so it's been great to be a part of something that's able to make such an impact in the community. Thank you for taking the time to learn about our programs and services. I will be around if you have questions. I will also provide contact information so that you can reach out to me through email or by phone. Thank you.